That's what diverticulosis is. So another thing that could be causing the bleeding could be ulcers. So that would be down here, and ulcers is just an opening in the tissue that could occur inside the GI tract, and that would of course cause bleeding inside of your patient's GI tract. Adverse effects to medications always are going to be on there for geriatrics. See, do not take complaints lightly. So yeah, so if a patient is complaining of pain, usually, I mean, not usually, but it can be a big deal. Again, it's because they don't feel pain like we feel pain usually. They're slower to react, and the feeling is less sensitive. So if you have a geriatric patient that is complaining of pain, you want to actually pay attention and take it seriously, just to be safe. Can be associated with a number of serious conditions, obviously, can be threatening, life-threatening, and again, it just is situational. Depression and suicide in older adults can be caused by, so these are all the reasons why your patient could be depressed or suicidal. And again, we're talking about the geriatric population. So this does not apply to it doesn't apply to all adults and pediatrics, it's geriatrics. Conditions that limit activity. So again, as the body declines, these patients are not able to do as much as they used to. So that's going to affect them mentally and psychologically as well. Medications that sap energy, of course, loss of friends and spouse, whether it's from just arguing or them passing away, biochemical imbalance. Shingles or herpes roster. So we talked about shingles already. You guys saw that patient with the belt, the blisters on their torso, a belt-like band around the torso, scabs up. Don't let it get on you. So this is big right here. So geriatrics do tend to get fractures from falls pretty frequently. So that is a common cause for a fracture in a geriatric, and that may very well be a question on the NREMT. So death may result from complications of falls, bruised ribs, cannot cough because of pain. So if your patient can't cough, they can't expel the bacteria inside the lungs. So then pneumonia builds up, okay? So that's why that can become an issue. May indicate more serious problem. Abnormal heart rhythm. So sometimes it is normal for your patient to have an abnormal heart rhythm. That is their normal baseline. Stroke, internal bleeding. See, assess for cause of fall as well as injuries from fall. So what this is saying is that maybe the patient fell down because of a stroke. Maybe they had a heart attack and they fell down. So don't just worry about the physical that occurred, the trauma that you're there for. What if it was a medical that led into a trauma? So that could also be a situation. So look out for that. See, elder abuse and neglect. Ways in which older adults can be abused or neglected physically. So they can be hit psychologically and financially. Can be difficult to detect. Yeah, sometimes. So usually an abuser will usually always be someone you love. It's always a family or friend, regardless of what the abuser is or the demographic of the abuser. So because of that, if a geriatric is being, let's say, financially abused by their daughter, then there's a very high possibility that they're not going to want to report them because they don't want to see their daughter go to jail. So that's why it makes it difficult to detect that. Many states have laws that require reporting of suspicions. See, effects on relationships. So over time, one member of a couple often becomes a caregiver for a sick partner. That is true. See, if caregiver becomes sick or injured, their situation may become difficult or impossible. Caregiver guilt or burnout. Okay, so this is just something to look out for. You may need to make short-term arrangements for the partner. So this is shingles on the face. So like I said, it doesn't always have to be on the torso, and this looks like it's extremely painful for this guy. And here's a video that I'm gonna share with you guys as well right now. Let's see, share you. Here we go.
Alzheimer's disease is a progressive, degenerative disease of the brain, characterized by loss of memory and other cognitive functions. It is the most common cause of dementia among people aged 65 or older. The neurophysiology of this disorder consists of alterations in the cerebral cortex, senile plaques, neurofibrillary tangles, and atrophy of the cerebral cortex.
Yes, he has. I saw him last night.
Alzheimer's usually begins after age 60, and risk increases with age. At first, the only symptom may be mild forgetfulness. People may have trouble remembering recent events, activities, or the names of familiar people or things. People in the middle stages of Alzheimer's may forget how to do simple tasks, like brushing their teeth or combing their hair. They begin to have problems speaking, understanding, reading, or writing. Later on, people with this disease may become anxious or aggressive, incontinent, or wander away from home. Eventually, patients need total care. The cause of AD is not known, and there is no cure. Suspected risk factors include age, family history, diet, and environment. Viruses are being studied to learn what role they might play in the development of this disease. No treatment can stop Alzheimer's disease, but for some people in the early and middle stages of the disease, some drugs may help prevent some symptoms from becoming worse for a limited time. Developing new treatments for Alzheimer's is an active area of research. Scientists are testing a number of drugs to see if they can prevent, slow the disease, or help reduce symptoms.
All right, here's another one, I guess. Let me show that one.
Elder mistreatment is the outcome of abuse, neglect, exploitation, or abandonment of older adults, and represents some of the most tragic behavior in the area of family violence. Any action or inaction that caused harm or endangers the welfare of an older adult may be considered elder mistreatment. Types of elder abuse include physical abuse, psychological or emotional abuse, sexual abuse, financial exploitation. Self-neglect, when the older individual exhibits personal disregard or inability to perform self-care. Institutional mistreatment, and abandonment. There are approximately 1.2 million cases of elder mistreatment in the United States each year. Healthcare staff working with older adults must be aware of local elder mistreatment reporting laws. Many states have mandatory reporting laws, and healthcare professionals must, by law, report suspected cases. There are three basic categories of elder mistreatment. Domestic mistreatment generally occurs within the older adult's home dwelling at the hand of significant others such as their child, spouse, or in-law. Institutional mistreatment occurs when a senior has a contractual arrangement and suffers abuse at places like long-term care facilities, assisted living, or hospitals. Self-neglect occurs when elders who are mentally competent enough to understand the consequences of their own decisions engage in behaviors that threaten their own safety. Older adults who are victimized are more likely to be 80 and above, female, and be living with their abusers. Elders who suffer from chronic, disabling illnesses that impair function and create care needs that exceed their caregiver's capacity to meet these needs are at higher risk of being mistreated.
All right, guys. So that's all for me today. Tomorrow we are gonna be covering special considerations.